And so right off the bat, we can see that Tyler's hand and arm, there's like a little bit of stuck flexion happening, right? The flexors aren't relaxing in a way where the arm can get completely down. You can see that the elbow is flexed. Maybe we want to work on the upper arm to help to drop the forearm a little bit. The shoulder kind of moves in relationship as I press down here. We're just starting to visually assess zones of tightness that we may want to work on. As I do some compressions, and like opening compressions, I'm just noticing what tissue feels tight. Frequently, I'll check in with clients after the compression and just say, was there anything in particular that felt tender to you? At this wrist, I really feel like I push down, comes right back up. I definitely want to work on the forearms. A little bit of traction. Maybe I want to gauge how far I can stretch. Great mobility and extension. Anything with that? And back there, great mobility with flexion. Are you a hypermobile human being? Would you say your joints are hypermobile?
I would not.
Okay.
I don't think so.
So I'm gonna, on purpose, try not to put too much emollient on Tyler's wrist because we do have some MFR for carpal tunnel that involves the retinaculum of the flexors. So I'll try not to put that on there so we can demonstrate that. But just general warming up of the area. Who wants to call out what stroke I'm doing here? It's a warming technique. It's going with the direction of the muscles at Farage. Changing it up, it's a little bit faster now. I'm not just moving with the fiber direction. What might this be called? Use your voices. Not myofascial because I'm using emollients and I'm not really creating a pulling force, but they're all up on the board. Cross fibers using the heel of my hand. Okay, so I worked on this posterior surface. Now I'm going to flip, anchor. Different world on the flexor side. Feel the tenderness there?
Not really.
Okay. I'm saying because I'm feeling like biceps brachii and brachialis here in this most distal place, feeling like it's lifting up into my hand a little bit. Right, so I'm addressing the whole upper extremity so that we can start to relax the muscles, get more pliability, prepare the body for some deeper work. Another form of cross fiber, working on these flexors, the radial side, flexor carpi radialis. Oh yeah, we can feel these tendons. Right?
Okay.
And luckily, as massage therapists, your person is probably going to have really accessible tissue that speaks to you really loudly and show you where the focus of your work is going to be. More cross fiber, still warming up. Okay. So, applying a little bit more pressure. Fairly mild to moderate stripping, yeah? class. And feel the tissue just warming up a little bit more, getting softer and more easy to get into. So I'll switch from moving into my thumb pads to using more of the tips of my thumbs to get more pointed pressure. If there's a particular area, does this feel particularly tender to you?
More than that areas.
More in this area?
Yeah.
I
like
might
it
just
down.
hold and do some static compression. I just feel like bundled tissue. Feels like there's something going on in here. Still doing okay?
Yeah.
Exploring yourself in there?
Yeah.
Okay. Yeah, moving towards this lateral epicondyle and then sliding off. You were smiling. What did you notice?
I don't know. I just really liked it. Like at the end, it felt deep.
Mm.
Yeah.
I find that a lot of folks really appreciate, especially with the deep tissue, the stripping, that you go from tendon to tendon, from origin to insertion. So just taking your time, supporting your own body, and moving through the entire muscle length. And this is what someone might want for lateral epicondylitis.
The feeling changes there.
What's the feeling change into?
I don't know how to explain it. But it changed from like, ooh, sorry.
It's okay.
But yeah, from like a little bit lower. So like, there was like a sudden transition where it changed. Yeah.
Okay. In intensity, in type of pressure or sensation?
Definitely intensity and then type. Yeah.
Okay. So now I've done like a basic general warming. I've done a little bit of specific work that's stressing the muscle from its entire length. Now I'm gonna get into this idea of friction. Right, so I'm finding the tendon. I'm not gliding across it. I'm keeping the tissue that I'm working on in contact with my thumb instead of gliding over it. And I'm working deep on the tendons of the extensors.
Whoa.
I have a question about that.
Hmm.
So, I only just, from your slides, learned that the condylitis are not inflammatory.
Mhm.
So, I'm just wondering, like, I'm imagining someone coming in and then I'm like digging in here and I'm imagining they're gonna be like, ow.
Hmm.
Is that not so much the case with the collagen degeneration?
So friction, and this comes from the textbook, but it also comes from experience. Friction can be uncomfortable. It's definitely not like a therapeutic relaxation massage. A lot of folks, when you're working in an orthopedic session, understand that there's like the pain pleasure threshold, and if we're able to sort of get the body to sensitize in that way, later they'll receive the benefits from the work by having more range of motion, decreased pain overall. So really you just want to like communicate with your client about the amount of pressure that you're using, because a little bit of ow is okay. A little bit of like hurts so good is fine. If it's just pure pain, then it's too much pressure or it's a neuropathy and you want to back out. But it's okay to sort of elicit that like pain pleasure threshold and challenge it in the therapeutic way that your client is accepting. Does that make sense?
Yeah.
Okay. How much pressure would you say that you felt in this zone
There?
while I was doing the friction? And I can try to recreate it.
7 to 8, but I loved it.
7 to 8, but he loved it.
Yeah.
So like pain, but acknowledges that it's like he's learning something. Massage is also a proprioceptive practice. It's a chance to like learn something else instead of just like my thumb hurts. It's like, oh, that whole area is inflamed or tight or is addressing something. And oh, I forgot that I was gripping my handlebar, that I was lifting way too much weight. So often there's like memory involved, or he's having a whole experience with his
Yeah.
body through this idea of pressure and challenging that idea of the pain pleasure threshold. Anyway, do we see the change that's already happened in his arm? How much more relaxed the elbow is, the wrist is, the shoulder? So when we say massage is not benign. When we say that massage makes changes happen, it can be both immediate and it also can take some time. Just again, getting back to the flexors, warming it up. Getting back into my cross fibers. I would argue that this is a zone where so many people are gonna feel tenderness and you're gonna feel tonicity because everyone's typing, everyone's on their phones, everyone's gripping and holding stuff. So in this case, we know that the common attachment site is the medial epicondylitis. So you can have your client, will you make a fist for me? And then bring your fingers towards you. You'll feel all that bulk underneath your pressure in the event that you ever forget or get lost in this area. Go ahead and relax. And because of that, let's just go right into some of this active shortening, okay? So, will you do that same action of making the fist and then bringing your fist towards you and hold. So he's pushing up into my pressure as I'm pushing down, and then relax. Good. And again, make the fist, curl the fist, and then relax. And now, don't be afraid to start including the lengthening stuff too. You can always work with them in combination. So this time, I'm gonna move your arm a little off to the side. I want you to do the same thing. Make the fist, curl it up towards you. And this time, when you let it go, I want you to open your hands, spread your fingers, and point them down towards the ground. And then point them all the way down towards the ground. Yep, active lengthening. And relax. One more time. Grip, pull, then open, and send it down. Great, how's that all feel to do?
Feels good.
I always check in with clients about how that work feels because many people have a competitive side to them and they want to like do it right and they won't tell you that actually really hurts or I don't know what I'm doing. Am I doing it right? So I always check in like, did that feel okay? How did that feel for you? Just to get some feedback into what it is that I've elicited into their body.
Definitely felt like you were working more through muscle there than compared to when you were doing it in the fascia, I think.
Okay. So Tyler's saying that what I'm interpreting is that it felt like there was deeper work, deeper musculature being worked on versus on the back where it felt more like tendon work, fascia work, connective tissue work.
Yeah.
Okay. Pin and stretch of teres or pronator teres. So I'm going to put him into passive pronation. I'm going to feel where the pronator teres is. If I need help with that, can you slam the thumb side of your hand down? And we feel this popping into my pressure. And relax. Then I'm just going to passively supinate him. Not the most firework expression of a pin and stretch, but still, if someone's spastic, if somebody has a compressed nerve underneath, this can be a great way to help create a little bit more space, more fluidity. And also a chance for you to feel all these different muscle fibers. Okay. Start another thing up on here. Okay, let's do pin and stretch of the thumb tendons. So, the thumb tendons that we were talking about is abductor pollicis longus and extensor pollicis brevis. So, what I'm gonna have you do is try to bring this side of your thumb up towards the ceiling, and I'm gonna resist you. Hold that. 3, 2, 1, and let it go. And then I move him into a stretch. So this is, I'm gonna do this just to gauge tolerance. Any pain when we do this? Okay. Now, same thing, go ahead and lift up. I'm gonna figure out where I feel that pressure, and then release. And then I use that pin and stretch technique. I also don't need his active engagement. I can kind of feel all the tissue stretching underneath my thumb as I move and stretch the tissue. It doesn't also have to be like one long stroke. You can take many little kind of caterpillar strokes to get there. then will you just try to flex your thumb? Sorry, I meant extend. Thank you. Go for it. So this is gonna show me where his tendons are. You notice that Tyler's tendons aren't so visible when they're firing, so having a little bit of palpation and motion is helpful. Go ahead and release. And now I can just do that little bit of friction. That's great for de Quervains. Okay. Cool. What else do we want to talk about? This one, y'all, it's you know your myofascial work, yeah? So you just want to find that pull and create it for the flexor retinaculum. You can work longitudinally because it's crossing this way. You can find that tissue pull and help engage the myofascial work by creating a little bit of a pin and stretch. Or you can work longitudinally, find that pull, and then separate your tool. Separate your thumbs from one another. Nice and light. Remember, if somebody's dealing with a neuropathy, lighter work is better. So don't be afraid to lighten, soften, go slow. As somebody who likes to work very deep and quite athletically, sometimes I have to remind myself to just slow down. Check in with my client. Okay. What's up next? Stretching. We kind of already did this. You kind of already saw me do this. So if I'm going to stretch the flexors, I'm going to find passive elbow flexion. Take one hand, peel open the fingers. With the other hand, peel open the thumb, and go a little bit backwards. Tyler has pretty good range. I can feel the end range is supple. It's not like a hard stop. I don't feel a lot of muscular pull. That doesn't mean he doesn't have a lot of tone. I felt that here in the flexors as well. Are you feeling a stretch?
Yeah.
Okay. Ways that you can enhance the stretch, active engagement. I want you to try to bring your hand from here back to here, and I'm going to resist you while we do that.
Cool.
Okay, go for it. It's like you're pressing your fingers, up into my hand, and don't forget your thumb.
I'm trying to, that's how it's a little bit harder.
Okay. And release. And as he releases, I take these distal ends and I go a little bit further, just checking in. Does that feel okay to do? Okay. Other way that you can get more stretch is to move the elbow in different directions and just see where you start to feel a tug. So doing okay? Great. Let's give him a break. Okay, extensor side, same thing. This one isn't, I don't particularly like when folks go into wrist extension for me, but I always check in with clients. Does this feel okay to do? Some people are fine with it. My body really doesn't like it, so I just make sure I check in. So will you do that same thing? As soon as you're gonna bring the hand, go for it.
Am I curling the finger still or no?
No, you don't have to worry about the fingers. That was really just a cue to get your body to move, but I just want the wrist to move. Great, and release. And same idea. If I go here, we go a little bit further. So it feels okay? All right, so neuromobility. We've got, right, the ulnar nerve coming down this way. We've got the median nerve coming down the center, and we have the radial nerve crossing and going to the back onto the thumb. We know the ulnar nerve protocol already. We hold the hand, we've passively flex, passively abduct, and passive wrist extension. Stopping, at any point where the client is feeling their neuropathy. Stretching the nerve and going back. Okay, ulnar nerve. Median nerve. Abduction, extended elbow, extended wrist. Median nerve. And rather than demonstrate with the radian nerve with Tyler, it's because we just did all this work supine, and this is one where you'd rather the client be prone. You just want to go into shoulder extension, elbow extension, wrist flexion. technically, if you scoot over to the side of the table, I could get all that to happen this way, but it really depends on the height of my table, right? So a little bit of shoulder extension, the elbow is already extended, and you can just relax. And then wrist flexion. So I guess I could demonstrate. And then you can take them back up, and then bring them back into it. All right, go ahead and scoot back. Coincidentally, those three things are homework that you can give your clients to do. Ulnar nerve, abduction, elbow flexion, supination, and wrist extension. Looks like this. Full version of it sometimes is about pinching the finger and doing that little hook eye thing, like superhero move that folks do. This is neural mobility for the ulnar nerve. The median nerve, abduction, elbow extension, wrist extension. Stretches out your median nerve, right? That one I also really feel, okay? And then radial nerve, boom. Shoulder extension, elbow extension, wrist flexion, okay? While you're working with your client, if they've got a radial nerve thing, you want to make sure that you're continuing the work up into the tricep and through the thoracic outlet. If they've got a median nerve issue, you want to work through the flexors, up into the bicep, into that axillary area, maybe even pec minor, clavicle, into the thoracic outlet, brachial plexus area. And last, if they have an ulnar nerve issue, you want to work here, go into the medial epicondyle, continue through the bicep, same as the median nerve, into the axillary, a little bit of pec minor, clavicle, scalenes, thoracic outlet. Cool? All right. Any questions? Yes.
Do you necessarily need to use the oil for this exercise? I'm just asking.
If you choose to treat the entire arm in a myofascial way, no you don't. But
Okay.
some of this deeper work, you probably do want to use it just so that you ease up the amount of friction there is. More comfortable for your client and probably more comfortable for you as well. But if you want to try a whole myofascial section, you can try that maybe for a time and then see how it will